It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Good morning. It's Dr. Bob. I'm here with PetSylvania. I'm really happy to be here today, and I want to thank Elanco, the maker of Trifexis and Comfortis. These two products are truly game changers in the flea control, heartworm control, internal parasite control region. There is no other pill than Trifexis on the market that will successfully control fleas, heartworm, and internal parasites once a month with a pill. To do that with any other products, you need topical applicators, and none of them work as effectively as does Trifexis. If your animal has never had a tick, the worry about getting ticks and the potential for tick disease is far less, and that can be addressed at the time you find your first tick. And so Trifexis does not do ticks, but we have a great collar called a Scalibor collar that if you are in a tick situation, we can help you manage that. If your animal gets ticks, we want to get them off as quickly as we can, and we want to then prevent any additional ticks from coming on. The Scalibor collar is really cool in that it repels ticks, kills ticks, repels mosquitoes, and it also provides some flea control. So Trifexis, now is the time. Hills now makes a grain-free diet so that they can fill that niche. They recognize that there's a growing niche of people out there for reasons that really can't be explained logically, to be honest with you, and they cannot be explained scientifically. Prefer to not feed grains to their pet. They're not going to give up that niche of dog food to lesser quality product, and so they've created a food called Ideal Balance. If you're going to go there, that's where you should go. I wouldn't go with anything that isn't from Hills when it comes to that, or any of the other lead manufacturers, Royal Canin, Iams, and Nestle Purina, if and when they come out with it. But right now, Hills is the only super premium diet with high quality manufacturing standards that is making that. All the rest of the stuff out there that you hear advertising on is more fluff than substance, and so I want you to think long and hard about using anything other than Ideal Balance. Esplin Medical is a maker of high quality, premium, environmentally friendly surgical scrubs. They have 3 styles of tops in a unisex top for men and women, and then for women there's a contrasting top and a 4-pocket top, unisex bottoms, and a jacket that's based on a Grey's Anatomy design. Most comfortable scrubs you'll ever wear. Buy a pair, wear a pair, and then call and ask us about, I'd like to hold a party to sell these to my friends. And you can make some money. Your friends will love you because you put them into a great pair of scrubs. 55% bamboo, 25% cotton, and 20% polyester. EsplinMedical.com. And then Sylvania Vet, of course, is our final sponsor, and that's my office. And by today's broadcast, we should be up on the Get Connected 13abc.com website, and you can then click on that, and you'll see our microsite. From there, you'll click on, and you'll see a 3-minute video about Sylvania Vet. I think you're going to really like it. We have a variety of taglines, and on the microsite, we used a tagline: "Your best vet for 24/7 pet care." Feel that's all true. We've been voted the best vet for the last 6 years. We're there 24/7. We're there for your pet care in any need that you could possibly have. There's literally no other practice in the area that can say that. So why settle for less? It's not a long drive from Perrysburg, from Maumee, from Oregon, Rossford, Blissfield. We have regular clients that drive into us from Sandusky, Bowling Green, and Adrian. So why not you? Let's talk about AAHA, the American Animal Hospital Association, and their inspections and standards. There are only 2 general practices in the area that are certified, inspected members of the American Animal Hospital Association. Sylvania Vet had that designation since 1978, so it's a long-term commitment that we have made to the best quality care, the best quality record keeping, the best hygiene, the most sterility of any other practice in the area. I've said this before, if you're not inspected by the AAHA, veterinary practices are never inspected in the state of Ohio. I've actually been in a facility where they burned incense and candles to control the odor in the building. That was extremely impressive to me. I was in another practice from a doctor that has a national reputation, and I walked in and watched him while I was visiting with him, and he was in X-ray with a cat strapped out on a table. He had his tie tucked into his shirt, and he was doing a bladder surgery on this cat without wearing gloves or anything. I was absolutely appalled. I went home and I canceled the subscription I had to the journal to which he contributed regularly, because I was so appalled that they would allow that to happen with one of their authors. Somehow you associate, if you're going to publish, that you're probably a top-notch guy, and I was pretty appalled. Some of the medical records we see when they're transferred from another practice are absolutely appalling. A medical record, we talked last week a little bit about the history. Well, that's what goes in the medical record, is that history and your recommendations. I see records almost every day that don't have that in. And to me, again, it's such a negative that if you only realize the importance of high quality medical records in the ongoing health of your pet, you would demand that they do a better job. Without the AHA, no one in the state of Ohio is required to wear caps, gowns, masks, or gloves in surgery, nor are they required to use a new sterilized pack on every surgery the sterile surgery that they do. Don't you wonder what goes on behind closed doors sometimes? That's something that I want you to think about. To go to healthypet.com and check out the AAA website, and you'll learn more about what the AHA brings to veterinary care. Sylvania Vet has a variety of volunteer programs that you might find interesting. We start with the original volunteer program that we had, and it's well over 20 years old now. I've never heard of another practice anywhere in the country that has this, and we call them Pet Pals. It's an organized 2-hour-a-week volunteer program where young people, junior high age through high school, come in and they spend time. Most of the time they spend time with the animals in boarding, but they are able to help us in other ways. They learn about responsibility of coming to their appointed time on time and ready to help. They learn about and having fun taking care of the animals, and they learn about the importance of volunteerism. And so the Pet Pals is a great program, and if your child has any interest in spending time with animals, this would be a good one. Adults that want to volunteer, we have a program that we call the Alohas. We modeled them after the people that volunteer in the hospitals that wear the Pepto-Bismol colored blazers. Our Alohas help us at the front desk, and they help open doors for people and carry carriers or push strollers or get animals in and out of the car. Or if somebody's bringing in a baby and 3 dogs, we try to take some of that load off. So our Alohas have a really good time. A younger volunteer group, which is usually in conjunction with a parent, is our cat cuddler program, that they go upstairs and spend time with the cats that are in our donor program. We have a program that we call Vet for the Day, where we use it as a silent auction item for fundraisers, and people come in and they spend a day behind scenes watching us run a veterinary hospital for a full day. And then we do a lot of mentoring of students from high school right through college, and provide internships for veterinary students as well. We had a veterinary intern from Michigan State this past winter. It's time for a break, and we'll be back on the other side. Thought that, what we could talk about, because we do provide 24/7 emergency care. Part of the reason why Sylvania Vet exists is exactly that. Our why is said in our mission statement: we are your pet's healthcare advocate. How can you be an advocate if you aren't available at all times and you have to rely on somebody else to take care of your pet after hours? That's why we're there. So what's a true emergency? What should you be calling about? What should you be prepared to have to come in on? Well, a cat that can't urinate, it's called a urinary obstruction. It's a male cat disease almost always. It can occur in dogs as well, Dalmatians being the most common, but it's far less common. But a blocked cat is an absolute emergency. That needs to be reduced as soon as it possibly can. A gastric torsion in a deep-chested dog is an absolute emergency. That's life-threatening, and even if we get into surgery within minutes, it sometimes can not have a positive outcome. So a gastric torsion, how do you know? Well, your dog may be retching and sounds like it's bringing something up from the depths of hell, and it's pretty much non-productive. If you look on the left side of its body, tap its abdomen just behind the rib, it'll sound hollow because the stomach is distended and filled with air, and it'll literally sound like a tom-tom. Obviously, if your dog's hit or cat's hit by a car, if you've got an arterial bleed from a cut and that blood's pulsing out, pressure on it while you're doing it, but you need to get in. It probably needs to be sutured and the vessel ligated. If we're going to be successful and not lose a lot of blood. Non-recovery from a collapse, your dog falls over and it doesn't get up. Obviously, you're going to come rushing in. You're going to be frantic. If it's in respiratory distress, you look at the dog, particularly cats. We see this a lot, and we'll see them, and you'll see them breathing, and they're literally, it'll be an abdominal lift. They're trying to use their belly muscles as well as their respiratory muscles to breathe because they just can't get enough air. If they're in acute pain and there's just nothing to do with that. If your animal has a seizure and it doesn't come out of it in about 3 minutes, you need to bring it in. That's called status epilepticus. That's a life-threatening situation. If your dog goes like a dachshund, goes down suddenly and is paralyzed in both hind legs, the sooner we can get in, get it assessed, determine if it's a medical response or if it's a referral to a neurologist for decompression surgery, the sooner we can do that, the better chance your animal's going to have to recover from that. So, and then again, we get calls at 2 o'clock in the morning, and why anybody trims their dog's nails at 2 o'clock in the morning and then they've cut them too short and it's bleeding all over the house, I don't know. Please reserve those things for regular working hours. I think you'll find that will be much easier to manage it, even if you have to bring them in. I think there are some emergencies that are truly household emergencies. Your dog has explosive bloody diarrhea. You may want to get your dog in just so let us manage that, try to clean up the mess, and you sure as heck aren't going to go to sleep knowing that the next one of those episodes might be coming right down the pike. And so we see those emergencies of convenience sometimes as well, and it doesn't matter. We're going to be there for you, and that should be reassuring. Did you know, this is really cool, and I've known this, and we've mentioned it a little bit before, but I think this is one of the coolest things, that we know dogs can do extraordinary things. Well, one of the things that dogs are being trained to do is detect cancer. They've trained dogs so that they can detect by the smell a melanoma, which is a malignant skin tumor that's too small for an experienced dermatologist to see with their magnifying glass. They can detect that. They've been able to detect presence of mammary tumors in women with breast cancer. They've been able to detect the smell of bladder cancer by smelling the urine. They've been able to smell the breath of a person with lung cancer and determine that person has lung cancer. Now, that's certainly not the end of the diagnostics. It truly is an interesting approach. And the interesting thing is that when these animals are trained, they have about 80% accuracy in both sensitivity and specificity as to the kind of cancer it might be. That's a pretty amazing number, I think. And so cats, we worry a lot about arthritis in dogs, and the dog's getting up a little slow, and we'll hear at a wellness visit. And again, I'm going to emphasize the importance of those wellness visits like I did last week. I think my dog's got a little arthritis. Well, the reality is we don't tend to notice that as much in cats. So it's an underappreciated problem, but we definitely see cats that show the effects of arthritis. And the things that you might look for would be potentially a decrease in grooming. It's not as easy to turn around and lick and groom their rear legs or their back or their sides or their rear end. And so they stop grooming, and now the hair gets kind of oily and flaky, and it gets a little bit matted together. They may not jump as much. They may have difficulty getting settled in and laying down, where before it would be nothing, curl up and they're ready to go. They may have to move around a little bit to get comfortable. We see it in cats more in the elbow than in the hips, where in the dogs we see it more in the hips than we do in the elbow. So they might be just a little stiff walking in those front ends. And one of the things about arthritis in cats is there's not as much as we can do. Therapeutic laser could be a great modality for us. Joint-sparing products like Dasaquin or Duralactin would be products of choice to help protect the joints and ease the arthritis that your cat is experiencing. There is no good non-steroidal medication available for cats that's safe to use over an extended period of time. So like if it was you or I that were having this, and we might take aspirin or leave or something like that, which we would never give to our dog and absolutely never give to a cat. In dogs, we have Rimadyl and Medicam and other high-quality non-steroidal products that we can safely use. We don't have anything like that in cats. So we do have a product that we use somewhat off-label that's called Adequin. Adequin is an injectable, and it's a pharmaceutical product. It does work, and we find that if we do that on average every 1 to 2 weeks in a cat, we can really ease their arthritis and make them more comfortable. And that's really the goal of all arthritis management. Another thing that you might try is a high-quality omega-3. We know omega-3s will help joints, and so cats can benefit in their joints as well as some other areas, their brain and their skin as well, from using omega-3. We use a product, recommend a liquid product that also comes in a capsule called Wellactin. Cognitive dysfunction, or doggyheimers or kittyheimers, if you will, certainly affects our pets as they get older. I got a dog showing some of the effects of doggyheimers at home. 14-year-old Portuguese water dog, and she still, will go on a 2-mile walk and truck along and do pretty darn well. But the reality is there definitely are times when I'm not sure she's got both oars in the water, or at least that they're pulling in the same direction at the same time. There are products out there that we can use that can help them with their cognitive dysfunction. And so one of the questions that you might ask as your animal starts to get up to 10, 12, 14 years of age and start looking for some of those signs. Is your dog barking when you can't explain why it's barking? Is it standing in a corner and looking at its shadow? Is it off, not spending as much time with you? Or on the other hand, maybe it's just become very demanding of attention, that more than it ever did before. A loss of some control of urine and bowels, the loss of some of that housebreaking. Those are all potential signs that are associated with cognitive dysfunction. We have to rule out medical conditions in the older dog that might be contributing to those clinical signs. But once we come down to cognitive dysfunction, then products called Senilife and another product called Nutrix can be really beneficial. That Wellactin omega-3 fatty acid that we talked about definitely is high on our list, one of the first things we start. And then doing things to enrich your dog. Take it for short walks. Help it out. Keep it comfortable with pain management if necessary, if it's got sore joints, because chronic pain can also be debilitating and cause other things to go on. It's time to take a break, and we'll be back on the other side. Well, here we are back to wrap up today's show, and this is 2 weeks out since my open heart surgery, and again, I just want to thank the people that are responsible for me still being able to bring you PetSylvania, and that's Dr. Craig Hoppel. He saved my life. Dr. John Letcher, surgeons, Dr. Mike Morant, and Dr. John Piggott, the huge and very competent team at Toledo Hospital in their cardiovascular and vascular units. I cannot thank them enough. If there was a way to take every one of them out to dinner, I would for sure do that. And again, thanks to all of you for your prayers and support, because I couldn't have done it without all those positive vibes. I want to encourage you to come to Paw Hurrah, which is the big fundraiser for Planned Pethood. And I'm sorry I don't have the exact date in front of me, so Google Planned Pethood and you'll find out the date. It's late in the month of April, and you'll have a wonderful time and help them raise money to carry out their mission, which is absolutely outstanding. We're going to have our seminar at the office with Dr. Jen Tate talking and presenting on her experiences with Hurricane Katrina and Hurricane Charlie and her deployment with the VMAT team. As I wrote all this stuff, I absolutely forgot the dates, so I'm looking it up really quickly here to try and get you the date Dr. Tate's seminar is going to be. It's going to be April 24th, which is a Wednesday night at 7:30. There will be door prizes. There will be a drawing for a gift card. So come to that. Come to the Paw Hurrah. Again, I'd like to thank my sponsors, Elanco, makers of Trifexis. It's time for that. If you've not been giving heartworm and flea control year-round, it is now time to start that. Hills, maker of high-quality science diet and the maker of game-changing weight loss product called Metabolic Diet. If you have an overweight animal, you need to call us, hear about it, schedule an appointment so we can do all the necessary steps to get it started on Metabolic Diet. Esplin Medical, the maker of high-quality premium scrubs that are environmentally friendly, naturally antibacterial, www.esplinmedical.com. And then Sylvania Vet, check us out at TV 13 at Get Connected. See what you think. Let me know what you think about our 3-minute infomercial that's on there. We had several clients that did just a wonderful job telling about their experiences with us. I'm really proud of that product. I'm proud to be a part of Get Connected. It was truly an honor to be asked to be a part of that. It's just another way that we try to stay involved in the community. So with that said, there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.